Thank you so much for that introduction, and welcome to our incredible panelists, Loyce, Gina, and Roopa. Thanks for being with us today. The idea of equal everywhere has taken on special resonance in the past year with our global pandemic. Emerging data increasingly suggests that the social and economic toll of the pandemic will be overwhelmingly paid by the world's girls and women. This ranges from increases in gender-based violence, mental health impacts, and employment impacts. We know that in the United States, for instance, of the 140,000 jobs lost during December 2020, all of them belong to women. In our field specifically, while globally 70% of healthcare workers are women, 73% of executives in global health are men. We'll dive into these themes and challenges throughout our time together today. So I'm going to start with you, Roopa. Why is it essential to include women's perspectives and experiences when crafting policy responses to health crises such as COVID-19? And how can we increase the number of women in global health leadership?
Thanks, Kate. As you started opening this session, we know that COVID-19 has exposed deep inequalities within and between countries. Pandemics worsen existing inequalities, and especially gender inequalities in the health and social workforce is one of those longstanding inequalities that has weakened health systems everywhere. We also know that women are shock absorbers. They carry a burden of unpaid care work that expands in emergencies. Women and health workers also have an unexpected expectation to perform impossible balancing act of both paid and unpaid work. They're facing increased amount of violence, harassment, and yet they don't get the opportunity to be on decision-making tables. We cannot fight the global health emergencies or even everyday problems in health drawing on just half of the talent pool. We did a recent review taking a look at women's decision-making in COVID-19 task teams around the world, and 85% of those task teams from over 87 countries were majority men. Less than 5% had gender parity. So when we exclude women from decision-making at all levels, it weakens health systems and the pandemic response. We need women at the table to bring their expertise. Women also know the knowledge about what's happening at the front line in their household and their communities, and they're experts both at health and care. Diverse perspectives we know leads to better sustainable solutions, and without diverse perspectives, we're going to continue to miss on addressing this global pandemic. Women are experts in the health systems. They know the best. There is no shortage of them in the health field. And we really just have to take the time to put the political commitment and really make sure that women are included in decision-making at all levels. And until then, we need to continue to challenge power and privilege and really make sure it's women from diverse backgrounds, women from the global South, women from minority backgrounds that are underrepresented, and especially women that are frontline health and care workers are included in shaping our pandemic response.
Roopa, thank you. That's a really powerful set of calls to action to all of us to try to rectify these challenges. I might ask Gina and Loyce if you can share in a few words, how are you all trying to address this challenge of gender inequality in pandemic response issues? And what is your advice for policymakers and other change makers? Gina?
I'll just jump in and I mean, I knew the statistics that Roopa just shared. I'd seen them on paper. Hearing them again make them all the more shocking. But to your point, Kate, a call to action. It is not to disparage any leadership by men, but it is an empirical fact that women listen better. Women multitask better. I think through many centuries, women have had to develop those skills. What better time to use those skills than right now, solving a global pandemic? The ability to listen, then take it and multiply it into multiple parts that you can manage and then distribute out. It's a critical skill. It is one that women have uniquely been blessed with, and we want to use. It is frustrating to not have the seats at the table that would be equivalent and allow us to do that. So I'm very intent upon being a part of the solution to try to get us at the table and use those skills that I think we have.
Thank you, Gina. What about you, Loyce?
Well, I think for me, I really, I can appreciate both of what Gina and Roopa have shared so far. From my vantage point, women really, we as advocates really need to be putting women forth as people who are not just experiencing one issue or another. And so I think in this age of COVID, it can be really tempting to see this just as a health problem, right? And I think what Equal Everywhere is doing and trying to put forth is the fact that women are whole people, right? And women have a range of issues that they're facing. And particularly in the wake of a pandemic, we're seeing all of these various issues come to bear, right? Like everything is showing itself suddenly. And so I think in our advocacy, we should really be putting that front and center, the fact that it's not just a health problem, but also that there are these other ripple effects when it comes to COVID-19. And so as Roopa talked about sort of the intersectionality of the people we're talking about today, it's not just about the diversity in terms of their identity, but it's also the diversity of their experiences.
That's such a great point, Loyce. And you each sit in different, contexts, right? Gina, you work for a major company. Loyce, you've been a global health advocate for years. Roopa, among other things, you're a frontline clinician yourself. How do you think, we each can take that intersectionality forward? What are the kind of actions that each of us in the communities that we're a part of can do to try to make sure that not only our whole selves show up in the contributions we make in this pandemic, but that we're helping inform, policy and programming solutions to try to make sure it's exhibited that way too?
Yeah, so Kate, exactly what we need to do is leverage our influence and leverage the influence of all of our organizations and the broader community we belong to, and really make sure we put a spotlight on women and the issues that are affecting them. What Loyce was saying really resonates, not just with me, but our global movement, that we really need to start looking at the entire experience that women are having, whether that is in their households, in their communities, in society, or at the institutions that they're operating in. We need to really be gender transformative and root out the drivers of inequity. Right now, estimates say that gender equality is going to take us at least 100 years. We're afraid that this shadow pandemic that is impacting girls and women especially is going to widen that gap. We already know the implications. Kate, you talked about some of those numbers. And what Women in Global Health is doing is we're linking up with the World Health Organization and the government of France, as well as many partners, to launch the Gender Equal Health and Care Workforce Initiative, really taking advantage of the fact that we're celebrating the Beijing Plus 25 years anniversary with the Generation Equality Forum, a platform for action, and we're going to be calling for action on the health and care workforce. We know it's time for a new social contract, one that is based on gender equity in the health and care workforce as one pillar, but this must go beyond the health sector. And Loyce, what you're saying there is we have to begin in places that we know we can drive the agenda here today, but collectively we need to accelerate action on gender equality for all women, and especially women that are underrepresented, those women that don't get a voice or a platform.
And what about you, Gina, from your role at AmerisourceBergen? What are you doing as a company to address this? I know you're showing up in lots of ways.
It is very important to us, and even before pandemic became a part of our every hour vocabulary, we were concerned and actively trying to support women in our organization. I know I'm very fortunate to be a part of an organization like AmerisourceBergen that does that. And we talk about equal everywhere. I believe one of the things we have to be realistic about is the mental health stress on women is in many ways equal to all of the other stresses. And for women in the workplace, which I'm probably closer to, the stress of trying to do their job, mostly virtually, raise their children, educate their children, do all those things. The mental stress has been documented, well documented, and it's tragic proportions. So what do we do? What can we practically do? We have to lead. Like recently, I told my team, many of whom are senior officers in the company, eliminate 2 meetings a day. Just eliminate them. Find a way to eliminate them. Take that time. Have your teams go. In our case, build a snowman. It's a lot of snow in Philadelphia these days. Or do something that gives a mental break. That's a practical way to do it. And we've got to care about the mental health just as much as we do about everything else, and it's critically important during these times.
Thanks, Gina. I want to invite Loyce, you to share the last word. I think you're great at kind of summarizing in a succinct way. What should our call to action be out of this conversation?
Well, I might come at this from a more personal perspective. What Gina said, I really heard as women helping women, and us each understanding our respective needs and making sure the needs of others are met in a similar fashion. And so frankly, that's what I plan to do, and that's what I try to do every day in the middle of this pandemic and otherwise, as Gina was saying, because we know that women work. I mean, that's the other thing that I've gathered from our discussion today is women can find people in the nooks and crannies where they need to be met. We know that there are a lot of unmet needs, especially in the wake of COVID, and especially when we think about vaccine equity, but also access to care broadly. And so, if we really trust these women and work to bring them out of the shadows, then we can reach that many more people.
Well, this has been an incredibly rich discussion. Obviously, just the tip of the iceberg, and I wish we had more time to discuss. But I do want to thank you, Gina, Loyce, and Roopa, for your time today, for sharing your wisdom. It's a gift to all of us. And looking forward to continuing the conversation in future fora. Thanks.
Thank you.
Thanks,
Thank
Kate.
you.